celebrate the small steps because they matter. Whether it's 1 day of sobriety, 1 hour of sobriety, 4 hours, the small steps matter. And eventually you will get to your goal if you just keep on that path of moving forward. And for families, I would say don't lose hope. Recovery is possible, even when it seems like it is not, because your loved one might be returning to you. As long as they are alive, recovery is possible.
Well, we are here today with Project Basecamp, and we have a great guest today. Her name is Terry Waters. She is a nurse practitioner, and her and I go way back. We were working together side by side with El Centro Family Health in Española, and I'm so happy that she could join me today and talk about her role, how she became a nurse practitioner, her background, and what she's doing now. Terry, if you could start just by letting us know what you're doing.
I'm a nurse practitioner in Rio Arriba County, and I'm providing mostly medication for opiate use disorder. I do a lot of other things too, but that's my main role right now. And then I also see patients via telemed throughout the state, so I'm able to expand services that way.
And Terry, you said that you've grown up in Española and you've lived there most of your life?
Yes. So I was born and raised there. Never really had plans to leave the community, and so, yeah, I'm still there.
Mm-hmm, yeah. And all your family is there too?
Yes.
I was wondering if you could paint a picture for us about what it was like growing up in Española.
I always think back to a place that reminds me of home, and that's the Santa Cruz Church, the White Cross in Santa Cruz. That every time I pass through there, that's home for me, and it is like a staple in the community. A lot of people know where it's at. People might go to church there or whatever, but it just brings back like childhood memories for me because, I lived in the area. We used to go there as children to go play and just, so I just... when I see that, it really reminds me of home. But then it also carries like some bittersweet kind of memories because a lot of people from those memories are like not with me anymore, So, but yeah, it's a small community and it's home.
As I know too, growing up there, that there's so much culture and everyone is connected, and like you said, the community is built on faith,
Yeah.
Even just yesterday, it was Good Friday, and people from all over are doing that pilgrimage because they know that it's a sacred place.
Mm-hmm.
But what do you remember about that in your family? How was that rooted in your family?
It is a tight-knit kind of community, I think maybe because it's smaller, and it's very common actually to know generations of families, like you're not just an individual, like you might know their grandparents or even their great grandparents. And so there is that sense of of community there. You know people, everybody knows either you or of you in some capacity, or so there is a lot of culture there too, like you mentioned, just yesterday, it really showed the culture in Española and that area was strong yesterday. The lowriders were out, people were walking and going to the santuario, and then town was packed. It was like just a big community event. So culture and pride is, I think, it's what Española stands for. Even though there's all of that stuff, there also is struggle there too, and but it also is like a community of resilience, even though there is struggles, there's also hope and help and family that just shows up for each other, community members that just show up. So it's a great place.
You said that you never really moved away, but it sounds like because you really care and love your community and you're proud of where you come from?
I am.
Mm-hmm.
I don't think I've never wanted to move away. So even when I got into like medical, and even when I was a baby nurse, and people wanted to, like some of my friends were talking about traveling and moving out of the area to practice, and that was never really like a desire for me. I wanted to be able to support and provide care in my community.
Could you maybe just tell us a little bit about, from childhood, something that you remember about addiction or the struggle within your own family?
Yeah. So, addiction does run deep in my family. It's generational. And I think probably one of the things that I remember about it was the very first time I saw my dad injecting heroin. And I think the one memory that sticks with me the most through all of these years, because I was probably like 10 years old when this happened, is the look of guilt on his face. I think that's a part of his life that he always tried to keep secret, or hide from us. And I think reality hit when he saw that I saw him, and it just brought up a lot of emotions. I was a kid. I really didn't even know what I was seeing. I know that it seemed serious. Whatever was happening seemed serious. And I don't even think I told my mom about it. I didn't want to like start a fight or, have them argue over it. But now, like when I'm, obviously I've grown from that, and I'm just like, I think that now when I like reflect on it, it wasn't just an issue of that time. It was like something bigger and deeper than that. It was not just something that happened once, and but that's one thing that I always remember when I first started to realize like addiction was in my family, and it was something my dad struggled with for his, as long as I can remember. Probably my entire life, So
it sounds like a memory that was confusing to you, and you questioned. But then when did you find there to be pain in those memories?
It obviously disrupted our family. He was, it affected my mom's relationship with him. It affected our relationship with him. So of course it brought like a lot of pain into that, just because we wanted him to be home, but sometimes he wasn't, because he was out, doing something else or trying to feel better. At the time, that's not how I viewed it. I was young and I didn't understand addiction, so I always thought he was just out making bad choices, and he was selfish and doing things just really for himself and not having us in mind.
Was there anything about what you were witness to that influenced your path?
For one, addiction was not talked about in our family. So even though it was happening, it was actively happening, we never really talked about it. So it was something kind of that we just dealt with quietly, So as far as it influencing my path, I just knew it was something I didn't want to repeat. And so I worked hard on myself and educated myself, and I was just very aware that that's something that I didn't want to happen again, that I didn't want my kids, when I did have kids, to be exposed to, And so I worked hard at trying to change that, trying to change that path.
You mentioned this is a generational thing that we see within the community. When did you realize it wasn't just in your family?
growing up in it, again, it was not talked about, and so it wasn't something that you just kind of brought up to your friends or, but then, I would say probably like in my teenage years, it would come up sometimes, like I would hear somebody say something about their family member or whatever. So it was apparent that it was obviously not just my family. It was an issue of the community, and then it really came to light in healthcare. When I started working in healthcare, I mean, I started seeing patients who were sharing their stories, or family members who were sharing the stories of the struggles that maybe one of their loved ones was dealing with or something like that. And those stories just kind of felt very familiar, maybe in a different way, but there was a lot of similarities to the things that I went through, and that my family went through. So I think at that time, seeing it in the clinic really made me aware that this is like a community issue. It is, it does affect individuals, but it also affects lots of families, and it has for generations.
At any point, did you ever feel shame about what was happening? Or when you started to recognize other people were going through it, it kind of diminished that feeling?
When I look back and reflect on when I first started hearing and seeing and recognizing that addiction was in my family, I don't think I was old enough to process those feelings, or to even, I didn't have the language to identify it as like embarrassment or shame, so it was maybe like when I was older, I tried to make sure that I didn't say it out loud or talk about it to people, because I didn't want people to know, because it wasn't talked about, and I didn't know how other people would perceive my family if they knew, that something like that was happening.
Mm-hmm. It was important to you to build a life that you wanted and that wouldn't affect your future family and your children. How did you then build your own path?
I really knew, and I had it in my mind, the things that I did not want to repeat. And so really what I felt the only way to do that was to educate myself, and so I went to college, and and really when I first started college, I didn't even have a degree like actually picked out yet. I just knew that I wanted to do something to help the community, to help, my town, and so I went back and forth in the beginning from like, should I go to nursing? Should I be a counselor? Should I be in social work? And ultimately when I decided on nursing, it really felt like that was where I was supposed to be. That kind of helped me start to build my path, even though I didn't have addiction medicine as like, oh, that's what I want to do. That's what I want to specialize in. Initially, I didn't even think about that. I just knew I wanted to get into a field that I would be able to help people. And ultimately, the path kind of led to this. And it just feels like this is what was supposed to happen.
Where were you working as a nurse?
I worked in different areas. I worked as a ICU nurse when I first graduated nursing school. I did that for about a year. And then I did hospice care. I did home care. And then I worked for the state, so I did a bunch of different things before I decided to further my education and go on to be a nurse practitioner.
I'm sure becoming a nurse, your family was very proud of you. And, then thinking, oh, now she's going to go back to school again to be a nurse practitioner. What was the thought that you were going to go again to advance yourself?
I guess I just have this like internal drive to like, oh, there's still something else that I could still do, and even now it's crossed my mind, like, should I go back? There's still a doctorate degree out there to get, so I've even kind of wrestled with that thought, but haven't really decided on that yet. But I think I just I knew I wanted to maybe serve in a different capacity. So I think that's what made me decide to go back to school.
How long have you been a nurse practitioner?
I started practicing in 2017. So what is that? 9 years this year? Will be 9 years.
Awesome.
Yeah.
In that time frame, when did you start learning about treating addiction?
Well, I started treating addiction since 2017, but I guess, again, it was not like my initial passion to do that. But when I started practicing, I was in primary care, and whether that was my intention or not, or my focus, I was seeing patients with addiction issues in primary care, So, and I mean, that's the perfect place to start somebody because they can receive all the help that they need in one place instead of having to do like take care of their diabetes here and go here for this, or whether it was my intention or not, I mean, people who were struggling with addiction were sitting in my clinic already, so I just kind of incorporated that into family practice.
Did you make a connection somewhere that because of what you've experienced, that there was more passion behind you, patients you were seeing in front of you that had an opioid use disorder or alcohol use disorder?
Yeah, I feel like my experiences really helped me to see it from a different perspective. I try really to be compassionate with patients and let them know that this, the place that they're at is safe and they can talk about their issues and without judgment, and without the stigma that they probably are used to getting and seeing in other places, So I feel like my experiences help me offer that to them,
Yeah. I've found that I've grown a passion in it because I was always trying to find the key to feeling fulfilled in the career that I chose. So going back to nursing, I was an ICU nurse too, and a lot of times it was the last place that they would end, and that would be the end of their life. And there was a lot of patients I saw that were in stage liver disease, and they were repeat people that were coming to the hospital. I wanted to do something that was going to be preventative, and so then I thought maybe I could go back to be a nurse practitioner, and then I was in family practice with you and working there. But as I was treating diabetes or the chronic health conditions, I would be encouraging people to make changes for their lifestyle changes. But a lot of times people would just want the increase of the medications and maybe not really making those changes for themselves. But when somebody was really struggling with addiction and they shared their truth with you and you gave them that medication, Suboxone, that could just help take away those cravings, help take away those thoughts of using, and they would come back to the next appointment. It was like a transformation that you could see right in front of you, changing right in front of you. And when I realized that, like how powerful these meds are, and also too that they have somebody that they can trust, like you said, where there's not a bias or judgment, people were really wanting to make the change happen. And more willing to go down the path of talking then to the peers or talking to the counselor, or, You told me about your father, and I wanted to say that I'm really sorry about this because I remember when that had happened. But can you tell me about what happened to him?
Yeah. So, like I mentioned, he had always struggled with addiction, and when he passed away, we weren't really sure initially what the cause of death was, until I got his autopsy report, and it said that his cause of death was listed as a methadone overdose. And so it was, it was hard to process in the beginning, but it made me really think about it like his death in a different way. I didn't view his death as like a failure for him, or that, he lost or something like that, because, he tried till the very end. He was on medication. He was doing what he knew would help him, and so I think he fought all the way till the end. He was taking the medication, and he did what he knew what he thought he had to do. A lot of people might think like, oh my gosh, it took him, or he gave up, that is not a story of somebody who gave up. He stayed fighting his addiction till the very end. Mm-hmm. So, I just see the effort and the strength in that,
Yeah. Can you give us a little insight? Did he have sobriety, time of sobriety?
From opiates, yes, on methadone. So he was not actively using any illicit substances, any illicit opiates at the time. But he also struggled a lot with alcohol use. And so he also had end-stage liver disease. So I actually thought that was the cause of death for him. But it was not. That's not what they listed it as, and it probably had a little to do with both, because that he was still actively drinking, Mm-hmm. But, maybe it was just liver was not functioning the way it should have been, or was not healthy.
Yeah.
And there might have been just a buildup kind of medication. And yeah.
Just to highlight what you're saying, I think people really need to hear this, that methadone and combining with any alcohol, benzodiazepines, or other opiates, how deadly it can be. And that's why there's so many rules and regulations around methadone, mm-hmm. Which I work in a methadone clinic and prescribe methadone, and we take it so seriously. Mm. And I just want to say that hopefully somebody out there is listening to know that that could be the end of it for people, especially if they have end-stage liver disease that's mm-hmm. not being closely managed, or they're maybe not following up with their primary, and they're just going to get their dose and just go to the clinic, but it's so important just to follow the way that it's prescribed. Mm-hmm. And I do think that that's why methadone often can get a bad rap, because not everybody takes it the way that it's meant to be taken. Mm-hmm. Mm-hmm. And it is a life-saving medication.
Yeah, definitely.
Yeah. I couldn't remember, but at one point, were you also prescribing methadone?
No, I have not ever worked in a methadone clinic, just Suboxone, buprenorphine products.
With your dad, is there something that you and your family wish that you could have done differently?
I wish I would have known more about addiction earlier on, because I think it would have changed the way I felt about what was happening, and I think maybe it would have changed even our relationship, because our relationship went through a lot of, times where we weren't talking at all because, I was upset or whatever. I think it would have changed the way I responded to what was happening if mm-hmm. I would have been educated and known a little bit more about what was really happening, that what was happening was not just about bad choices, right. or being selfish or whatever. That's the one thing that I wish I could change, is that I wish I would have known more about it.
I think it's really important just to bring up that even yourself being in the medical field, that you might not have had all the answers either. A lot of families are struggling not knowing how to help, or who could help them. Mm-hmm. But hopefully spaces like this, where we're talking, open doors for people that have questions and families that need help navigating the system.
I'm sure there's a lot of questions that come up for families dealing with somebody they love that's in an active addiction, It's hard because it does affect the entire family. It's not just that individual. It affects their mom, their dad, their grandparents, aunts, uncles, their children, if they have. And I think there's a fine line too that I feel like maybe like families deal with, and they're like, they don't want, they don't want to make use easier for them, so they cut them off, or they they show that they're really upset, and so they're not really sure how much support to give, or what they're supposed to do. It's confusing, especially if you don't really know what's happening. Even when you do know what's happening, it's still like, you don't want to enable, but then you also you want to support them in a way so they know that they're not alone. But I mean, it's challenging. It's really challenging.
I'm wondering if you ever sit across from patients that you're seeing or treating, and you see your father in them.
Not necessarily like my father, but like similar struggles and similar stories. Sometimes it sounds very, very familiar. It's like, okay, yes, like, and I don't typically tell patients, oh, I know what you mean, because it's not about me, it's about them. But I just try to let them know that I understand, and I'm there to provide non-judgmental care for them, and I will help them along the way, any way that I can,
What about working in the community that you grew up in? Do you ever find that challenging?
I think early on in my career, it was a little, it was kind of hard for me because I was seeing people that I went to school with, and I don't know, for some reason, I felt like I didn't want them to be embarrassed, to come to me and talk to me. But now, I've been doing it, longer now, and I feel like it actually opens up doors of trust a little sooner, I think, for a lot of patients, because I am a familiar face, and maybe not for everyone, but I haven't had any patient be like, I don't want to see her because I know her. I haven't found it to be an issue, it actually feels very rewarding to be able to, help somebody that I did go to school with, or or that I know their family, or things like that. So
I remember, being in the clinic in Española, sometimes the little viejita, she would come in there and start talking about, and my granddaughter, and and you would somehow know who she was talking about, and then the granddaughter would come in the next day on her visit and said, oh, and you saw my grandma, even though we are trying to protect HIPAA, but it's kind of hard to, avoid that in a clinic where you grew up and you're in the same community. But I do think that seeing a face that they know, this person's probably like me, and they're talking like me too, so maybe they're from here, compared to an outside doctor or somebody that doesn't feel comfortable to them. I could understand why they would want to tell you about their life, tell you about their family.
It's actually kind of funny because, my last name is Waters. Obviously, that's my married last name. And so when people are making appointments or whatever, and they would be like, oh, your appointment's going to be with Terry Waters. And then I walk in the door and they're like, oh, I was not expecting you. I expected somebody else. You look like you're from here. You don't look like your last name would be Waters, or whatever. So it is kind of funny, because when they see, oh, okay, yeah, she is from here, or they recognize me, or they know my mom, or something. It's really cool.
In thinking about some of the patients that you've treated, is there a really painful story or experience that has really resonated with you?
I guess it's kind of sad to see that the generational impact it has, like substance use anyway. Like I've treated a father, and then I've also treated his daughter for the same thing. And then I've also, treated maybe a cousin. And so just the impact that substance use has generationally in the community, it's a sad reality, and I think that, it just shows how serious of an issue we have in that small community, But it is something that has been around for a long time, and I don't know that it'll ever go away, But yeah, I think that maybe hits home a little more when it's like, man, it's generations of this, in the same family, and it, I think that's maybe something that I think is hard, to deal with.
Have you ever had a patient that has experienced an overdose?
I have. I've been treating addiction since like 2017, and in a small community where drug use is really prevalent, and so yes, it is like a sad reality that it happens often, but even though it happens all the time, one loss is still significant, and it's hard because especially when them or they were your patient, and it's just like, man, it just hits differently, it's you feel for their family, you feel for their children, it's hard because you develop a personal relationship with them, a personal professional relationship with them, and how hard they tried, and again, it's just like going back to my dad's story, especially if they were in treatment, they were trying, it was just, they hadn't given up.
We talked about how people have so much pride and there's deep-rooted traditions within Española and the community. But what does addiction look like behind that closed door in that community?
Well, I think it can look like a lot of different things. You might see somebody who is struggling and trying to get up for work every day and trying to take care of their family and still at the same time dealing with addiction, trying to also feel well enough to do those things, So it can look like that. It can also look like somebody very isolated and embarrassed or feeling shame, and not seeking care because of that, and dealing with it alone. So, I think it can look different for a lot of people.
And I know you said the generational part is happening. What I remember is seeing the grandma come in with the grandchild because the parent is absent because of their addiction. And they're left to take this on. And maybe it wasn't their choice, and it really affects the children. Because when I was at the school-based health clinic, there was a lot of grandparents that were taking their grandchildren from babies and being the sole provider for them.
Yeah. Yeah, it's a sad reality. You have grandparents in their 70s and 80s raising very young children, but I guess that just takes me back to like the family support that is there in the community, even though it's difficult and it is a difficult choice for some family members, I think that's Española is known for that, like for strong family connections, and I think it shows in situations like this.
Yeah. Could you highlight for us maybe a person who you've seen rebuild their lives, or even within their own family, they've been able to rebuild their lives in recovery?
Yeah. I mean, those experiences, it just makes me so proud to be able to see that, firsthand. It's great. Every small step matters, and I try to celebrate that and make it known to every patient that even just shows up for their appointment, because sometimes there's a lot of barriers that even are affecting them even to get to an appointment sometimes, or even to make the appointment. They don't have a phone, or they're looking for Wi-Fi or something to just make that phone call to make an appointment, we celebrate even the tiniest little steps, because they're impactful, But it is awesome to see, like, when a patient realizes for themselves that this is possible, and when they come in and they've been, like, substance free maybe for 2 days, and they're like, oh my gosh, like, I didn't even think that was possible, they've been using for so long or whatever, and they just, that's a huge step for them, and it's awesome to see them realize that recovery is possible for them. It's awesome. And then I do have patients who, like, have been in recovery for a long time, and they're like, today I celebrated, 600 days, or, whatever it is that they celebrated. And it's just like, it's awesome to be part of that,
Yeah. Within the community, what programs are you seeing that are helping to support people in their recovery?
We live in a rural place, so there's not a whole lot offered in our area, but there is some peer support in the area. Not everybody feels like they need it, but it is available. There's counseling and lots of telehealth options now for counseling, so that's a great option for some patients who have phones and maybe lack of transportation or something, so there's a few resources that we refer to, and just let patients know that they're there if they need them, But not, counseling is not a requirement. It's not a requirement for treatment for them to be linked up with peer support or anything like that. We don't require anything like that. It's just, I always let them know that there's more help if they feel like they need it,
So on the other side of the coin, where do you feel like the system is lacking?
Well, limited resources for sure. That's one of the big things. Medication availability is a huge thing in our area. And I mean, maybe you even see it here, and I know you used to see it in Española. It hasn't changed much, that's still a huge issue, is the access to medication. It is encouraging, though, to see that there are more programs that are offering kind of this low barrier option to care, where, we try to get patients seen right away, because they might decide today that they're ready, and then you schedule them for a week, and by that time they, things change, or they couldn't wait that long or something like that, so it is nice to see that there are other options coming up now, and people are being offered even telemed appointments or things like that are making access to care a little easier.
Just to highlight what you were saying about access to certain medications, when I was there in Española, I don't think that this was like going into full effect. So maybe at some point 2022 to 2023, then I think it started happening. But to explain a little bit more, there's opioid litigation settlements that are happening that are disrupting distributors and pharmacies like Walgreens and CVS, and they're putting restrictions for controlled substances. So Suboxone, which is used to treat opioid use disorder, is falling into that category. And so pharmacies specifically, like Walgreens and CVS in Española have not been able to stock Suboxone like they would previously. And so it's disrupting the system there. And I want to know, how is that impacting your practice now?
I mean, it is very challenging for patients. I had this one patient that it was over like the holiday, like Christmas holiday break, and we had just stabilized him on buprenorphine, and I sent in, a longer prescription for him, and he went almost an entire week without medication because the pharmacies were out, and he didn't have reliable transportation to travel to Santa Fe or to Taos or Los Alamos or somewhere else. There is only 3 retail pharmacies in our area. 2 of them accept Medicaid. 1 does not. And then there's a small locally owned pharmacy that doesn't carry buprenorphine. So really all of our area they rely on 2 pharmacies, to get their medication. And it's really common that they run out. And so patients are without their medication sometimes for a week, sometimes even longer than that. Mm-hmm. So it negatively impacts treatment for them for sure, and it can be very dangerous, I mean, it's very similar even to like somebody who has uncontrolled diabetes. They're insulin dependent and they can't get access to their insulin. Like, they're going to end up in the emergency room, and the fear with not having access to buprenorphine obviously is overdose, and that's one of the main thing that we're trying to avoid, and trying to prevent is death, So, I mean, it is a huge problem in our area. So I really hope that gets fixed.
Do you think that a lot of those individuals that aren't able to get to the access of Suboxone are resorting to methadone?
I did have one patient, actually, this was a couple of years ago, initially didn't want to be on methadone because they didn't want to have to go daily, It was just going to really impact their schedule, their work, all this stuff, So they wanted to be on buprenorphine, and it was working out great for them. But every time it was time for a refill, they were going weeks without it because there was not any at the pharmacy, So ultimately this patient decided to switch to methadone because they just were so exhausted from that, from being stable to not having medication for 2 weeks, and they didn't want to return to use, and thankfully the methadone option was there for them, and they were able to get into the program because sometimes there's even waits for that, so it can be really problematic.
To explain differences between Suboxone and methadone. Methadone is a long-acting opioid, and it is highly controlled and regulated, so it has to be dispensed in a methadone clinic, and patients usually have to go on a daily basis to obtain their methadone unless they have step levels where then they can get take-homes, but they have to be able to complete certain things and have clean urine drug screens that show methadone only. Compare that to Suboxone. Suboxone is a prescription that, depending on the prescriber, they could give it for a week, they could give it for a month, they could give you a supply for 3 months, mm-hmm. depending on how stable you are. So individuals that are having difficulty with transportation, think about that, going to a methadone clinic every day in a rural community where you don't have a car.
Yeah.
And so even that is a barrier.
We also only have really one source of public transportation there, it's the Blue Bus, and they're on a schedule, and and the times might not always work out for you, or if you're scheduled for an appointment or something, you have to show up an hour early. So it is very challenging to be in a program that requires a lot like that, because that is a huge barrier for patients sometimes, is the transportation.
Yeah. And as we're talking about these treatments, I know even people within our own community have stigma about these treatments. And even in the medical field, there is stigma about prescribing Suboxone. And you used to have completed a data waiver that was about 16 hours of training to be able to prescribe Suboxone. However, in about 2022, they stopped that so that there would be more access to prescribers who prescribe Suboxone, and they took off limits for how many patients you could prescribe Suboxone to. Mm-hmm. So that was a major shift in the treatment system, but the stigma is still there. I even have patients now that say, my primary care doctor told me that I had to come here to see you to get Suboxone. And I will tell the patients and educate them about this process and tell them your provider, your doctor, your nurse practitioner can prescribe you Suboxone. Anybody that has the authority to prescribe medication can prescribe this to you. Mm-hmm. But it's their choice.
Right. I think that comes from maybe lack of education. Maybe not all providers are comfortable with it, but really, I mean, it's one of the safest medications out there, and I think with some training, it is one of the most beneficial medications to be able to offer patients in addiction who are dealing with opiate use disorders, But I really think that stigma probably stems from that maybe it's just a lack of education about addiction. And I also think there's been a shift in treatment too. Once upon a time, it was like abstinence care. We were really pushing abstinence, and you could not be using any other substances while you were on buprenorphine or you were on methadone or, and I feel like there's been a shift in that. I know in my practice, I almost look at it from a harm reduction lens, and if I can reduce harm even a little bit by minimizing the amount of substances this person is using, even if it's like, from, 10 fentanyl pills a day to 3 fentanyl pills a day, I am reducing harm by giving them this medication, and so I've really had even a shift in my practice. Just, not everybody is ready for abstinence, and you have to meet them where they're at, and everybody's goal is different, and you have to talk about those goals and help that person achieve that goal, and so, abstinence might not be what they're looking for right now. Maybe eventually, but baby steps sometimes.
And I agree to the point that maybe at this point I need Suboxone or buprenorphine, as the other generic name, or methadone. But hopefully I won't need these tools forever, mm-hmm. and I will be able to find stability in my life so that I can live in recovery, learning all the other tools that are out there for me to utilize.
Yeah, I do have some patients that will start conversations like that, like I don't want to be on this forever, and I always try to bring it back to, one, this medication is safe long-term, and you do not have to be in a hurry to come off of it, but when you do feel ready, when you feel like your situations have changed, you feel mentally stronger to be off of it, or whatever the case is, we'll work together to come off of it. I don't want patients to feel like they only have, 12 months or 6 months. And I tell them all the time, like, don't give yourself that limit, because some people might need this forever, and that's okay. It's okay.
Just to kind of come back around to you, I'm wondering how you feel now in your life. Do you feel like you've been able to come to a point of recovery for yourself through what you've experienced, or is there some places where you're still processing some of those things?
Well, I feel like the experiences that I had just in my life, I don't feel like they've ever really held me back. If anything, it kind of gave me a different level of knowledge, I guess, and it helps me, I think, be more compassionate with patients, so I don't feel like I really had a whole lot of healing, I guess, to do internally about it. Processing, yes, I tried to figure it all out along the way. In the early on, I really didn't know how to do that, but I think just by educating myself and understanding now I understand, what was going on. I also feel like it's helped me shape the way I practice too.
If your younger self could see you today, what would she say?
I think she would be proud, and maybe ask, where do you get your drive from? Where does your motivation come from? Sometimes I don't even know that answer, but yeah, I think she would be proud of how far I've come, and that I've changed the outcomes for like my family, and I decided to, do things differently. So yeah, I think she'd be proud.
What do you think your legacy will be in the community or even within your own family?
Well, I hope to leave a legacy of compassion, and I want people to remember me as somebody who cared and who provided care unbiased and stigma-free, compassion.
For anybody who's out there listening now who feels trapped in this cycle, feeling like they're not going to get out, or even they have somebody that loves them who's listening to this, what would you want them to hear?
I think for the individual who is in active addiction, I would say don't give up, because recovery is possible. And give yourself some grace, because addiction is, it is a chronic disease that sometimes you'll have some setbacks, right? And those setbacks are not failures, they're just that, they're setbacks, and you can always move forward from that, and just celebrate the small steps, because they matter, whether it's 1 day of sobriety, 1 hour of sobriety, 4 hours, whatever. The small steps matter, and eventually you will get to your goal if you just keep on that path of moving forward, And for families, I would say also don't lose hope, because recovery is possible, even when it seems like it is not, because your loved one might be, returning to use or whatever. As long as they are alive, recovery is possible. And it's okay to set boundaries, but also just try to remember that they are human and they need love and compassion, and they're really dealing with something that sometimes seems out of their control. And then also there's help even and support for families, in the community, for both individual and families.
Well, Terry, I'm so happy that we got to chat today. I really miss working with you.
I know, I miss working with you too.
I hope there could be other opportunities where we can connect again in the future, because what I recognize is that the individuals who are on the front lines doing this work, they become a pillar in the community, and eventually they start taking ownership and more leadership within the community, within the counties, within the state. And so I do think that in the future we will be in those positions helping lead these spaces and lead these conversations.
Yeah.
So
yeah, I actually have had the opportunity to train some maybe not new practitioners, but practitioners new to treating opiate use disorder, and it's really great to see that there's the willingness, out there, and people want to learn, so my hope anyway is access to care will get better.
yeah, me too. Well, thank you so much for being here with me today, and for anybody that is needing help, needing support, please connect with us, and we are so happy that you joined us. Thank you. Please help me in this journey to help change the trajectory of our story. We are Project Basecamp, and we are climbing to recovery.